This is Rayne's sterile dressing change. Just scanning the room. Alright.
Okay. Knock, knock, knock. Good afternoon. My name is Rayne. I'm your nurse, and we are going to do your dressing change. I would put the bed up to a good position for me. I'd provide privacy. I would ask them to state their name and their birthday, and I'd look at their wristband at the same time. And I would also have washed my hands and the table to keep that sterile, and then have given them some sort of pain medication, whether it was Tylenol or anything like that, so they didn't have pain while I was doing their dressing change. So I'm gonna pull your blanket down just a little bit so I can take your dressing off. I'd want to keep them covered up as much as I can. And I would take off just the tape. And I would have put hand sanitizer on before this too, even when I did wash my hands before I entered the room. Just take the tape off. Get a pair of gloves. Exploding gloves. And then I would grab the dressing and the gauze inside. I would assess the drainage using the TACO acronym. So T for type, whether it's sanguinous, serosanguinous, purulent. Amount, use like a universal size, whether it is like a quarter, baseball, anything like that. Color, if it was red, pink, if it was clear, it's kind of yellowy like pus. And then odor, and I'm not getting any odor because there's nothing on here. Their wound is healing up nicely if there's no dressing or new fluid with it. I would take and wrap my gloves around the dressing. If there was fluid on here, I would put it in biohazard, but since there's nothing on there, it's going in the regular garbage. Next, I would take a culture of it. I don't have the cap for it or the packaging for it, but you'd open it up very carefully, not to touch past where the glue is around it. Carefully take off the cap, and I would either hold it between my finger or throw it away really quick. And then I take the culture wand, and you go from cleanest to dirtiest. So I feel like the cleanest is the inside, and I would, gently go around all the corners of it. And then I would check the tunnel at 6 o'clock, get that, and then the one at 11 o'clock, and then carefully put that in here. And then I would take a biohazard bag, and I would send it to the lab right away. And on the thing, I would put my name, the patient's name, time, the date, and which wound it was, especially if they had multiple wounds. So I'm gonna send that to lab and just put that up here. Then I'm gonna put some hand sanitizer on. Because we are going to measure the wound. And since I might be touching the wound and touching their skin, I would just put it on just to be safe as a precaution. So I have my cotton applicators up here, so you'd peel those gently, again not touching the glue around it, and then you would push the applicators apart so you can grab just one individually without touching the other one. So once I have one, I will grab my measurement tool. Since this is a circular wound, I usually lay it on here, and I'd go about as perfect as I can to the middle, and I would note that it's 5 over here, 5 here, and the same with the bottom. And since I did use the radial one, it is in centimeters, so I'm going to measure the depth in both tunnels in centimeters too. I feel like it's very important to keep the units the same. So I'm gonna go here, 1 centimeter for the depth of the wound, I'm gonna do the tunnel at 6 o'clock. I don't know if that's in there. It is. That is 3 centimeters. And then I'll do the one at 11 o'clock. And that tunnel is 4 inches. If this had body fluid on it, it would go into the biohazard, but it doesn't, and everything is just gonna go in the one trash now. Again, you can keep this if you want and just clean it and put the patient's name on there, but I just throw them away and take the gloves off. And then I put hand sanitizer on or wash my hands. Apparently my nose really wants to itch right now. And then I'm going to open all of my packages so that I can do the new dressing. So for me, I always go around the table so I don't have to reach over or anything. You can minimize the amount of contamination to the table. So I would start with the Curlex. You always peel it. I always peel it up until the glue, and then I start going down one side, again keeping that boundary. Open that, and then I spin it around. I'm gonna slide this down just a little bit. No. Stay down. What? And same with the gauze. You want to do it and then be very careful because the gauze likes to jump. And then I'm going to spin it, making sure not to go past that glue border. And then the ABD, same with that. Alright, the next I would put the saline or sterile water into the Curlex. 3 important things to do with this is palm the bottle. When you take the cap off, don't put it upside down, you want to keep it down. And I don't like to swirl it around on top. I like to just do it from one corner of it because all of the Curlex will get the water soaked up. So I just do it from this side just to minimize the contamination again. Put that up there, and I would put my initials, time, and date on the saline so they know that they only have 24 hours to use that bottle, otherwise it's garbage. Hand sanitizer again, and then I will put on my sterile gloves. Okay, so again, you open this with, take the gloves out. I'm not gonna turn around to the table, I'm gonna face at it, but take that, put that in the garbage, Open this and keep that 1-inch border on the inside. Alright, I'm gonna grab my glove, step back, so then I won't touch the table on accident with my glove. Put it on, get one free adjustment to pull it down. That hand's sterile. Just gonna squeak the air out of it. And then I grab the next one. Again, step back. Make sure they're on there good. That's not sterile anymore, so don't touch that. You can kick it around on the floor, but not with your hands. So I'm gonna pull this. I wouldn't touch the outside, I'd pull it closer to me a little bit, and then I would gently get most of the saline out, just so it's a little bit wet, being careful not to let it drip on the table or to splash on the gauze or the ABD. then you would unroll it or open it up if it's a big brand new one. And you want to be careful not to let this fly all over the place. You want to gently unroll it, and you don't want to put your hands below your waist, especially when you have curl-X, because this will get on the floor because it's so long. So I brush through it a couple of times, and then I fan fold it in my hands, making sure not to let the curl-X swing too much either so it doesn't touch your shirt, because your shirt is not sterile. Then I'm going to grab the last applicator in here. Be careful just to touch that. So now you want to start on the edge and push it into the tunnel, being careful not to let the applicator or the curl-X touch outside of the skin, because then you contaminate it and you'd have to start all over again. And then you want to tuck it into the second tunnel as well. And then I'm gonna flip this around just so I can push it down a little bit more because it keeps moving. But your glove, the applicator, and the curl-X that is in the wound on top is all sterile. I just feel like this helps to push it down as you're packing it with the applicator. And then once it's all in there, I pack it in there. Hands up and throw the applicator away. Then I come and I grab the gauze. I fold it up, being careful not to touch the outside of the wound. Grab the ABD. I lay that on there and unfold the edge right there. And then I take my sterile gloves off. Throw that away. Then you get your tape. Why am I blanking? Put it on here, and then you would like time and date and everything on here, your initials, so the next person knows who to come after when you put the dressing on there. I usually try to measure it first and then peel it off and put it on there. And then press it on the wound, but you don't want to press it super hard that you cause pain. after you have everything, time, date, and initials, I would ask the patient if they needed anything, if they were in any pain, because I could give them more pain medicine if the MR allowed me to, cover them back up, put the bed back down to a safe height for the patient, have their call light, and then I would make sure that I brought the culture down to the lab, and I would make sure that I documented and charted that I did change the wound, what kind of wound it was, and then a culture was taken and everything like that. So that's how you do a sterile dressing change.